I'm going to call this meeting to order.
I believe we have a quorum, right? Five. Yeah. You count as one vote or two votes? Just one. Okay, great.
Okay, we're going to start with introductions. I'll start with myself, Angela Conti, representing Community Seniors and Disabled, and Community Committee Chair.
I'm Steph Britt, SCTCA staff.
Kathleen Cortez, AAA staff.
Jessica Alcazar, Mobility Manager for Adult and Aging.
Muhammad Ali, MP Transportation, Santa Rosa Paratransit, Vice Chair.
Colin Toma, Disability Services and Legal Center.
Jeffrey Maxey, average citizen.
John Gaffney, ADA Compliance and Program Manager for the Golden Gate Bridge Highway and Transportation District.
Charles Smith, Sonoma County Transit.
Okay, as a reminder, I do have a hearing problem, so I believe everybody's mics are on, but do speak up. Thanks. Oh, and let's go through the folks online.
Would you like
who
me
are
to
joining
read that?
us?
Donna, if you want to read out the names.
I can read the attendees. We've got Alice Lynn, Araceli Vasquez. It looks like Carolyn Buck, Catherine Busey, Chris Cohn with SCTCA, Kenya Martinez, Lauren Garibaldi, Nicole, Selena Gonzalez, Sandra Pieter, and Swami, I can't pronounce the last name, I'm sorry, it's Kodityala. And are any of them committee members that need to be promoted to panelists?
Oh, Araceli Vasquez, please.
Araceli declined to be promoted.
Okay, and we do have a forum today. And Don, let me know if I missed that somebody wants to speak in the discussions online. I sometimes don't catch that. Thanks.
We do have 4 panelist members that you may want to have introduce themselves. I'm sorry, 2 panelist members to introduce themselves.
Okay. First is public comments on items not on the agenda. We have some comments from Jeffrey.
Yes. Good afternoon, guys. Thank you so much for allowing me to be here.
The microphone.
Good afternoon, guys. Thanks so much for allowing me to be here with you. Oh, this is scary. All right. I am a resident of Sonoma County. I live in the city of Santa Rosa, and I take public transit. If you'll notice, I'm in a wheelchair. Here's what I'm looking at. I put a survey out. I don't know if you guys are familiar with Nextdoor or not, if you've ever used the app Nextdoor. So I put a survey up for Sonoma County, I guess. And basically my survey said, how many people in Sonoma County think we should have porta potties at this SMART train? And then in parentheses, SMART, given its very simple name, I think that it's a good idea. And so I put 4 responses to that survey. The first was a obvious yes. The other was no. The third response is no, it's everybody, every person for themselves. And the fourth response is, are you joking? Of course, it's a great idea. I'm going to put this out there to you guys. What do you think of those 4 responses? Which do you think got the highest response? There were 355 people that responded to this.
Are you joking?
355. I'm serious. So what do you think is the highest response? Do you think it's no, every person for themselves, or yes, no, or are you joking? We should have this. What do you?
Are you joking? You should have this.
Okay, so the number 1 response, 60%, 214 people was yeah, it's something we should have. Yes. The smallest response, no, it's every person for themselves. That was 6%, 20 people. No, 19%, 68 people. And are you joking? Of course, it's a great idea. 15%, 53 people. Now, I bring this to your attention because obviously people here in Santa Rosa, people in Sonoma County would like to see this happen. Okay, I've come up with what I'm calling a clean transit access initiative. I think you guys, sorry, I think each of you guys got a copy of it. But basically it is a plan for us to be able to implement public restrooms, porta potties at smart train stations. And I will share this with you. The biggest no response was no, because there are restrooms on the trains themselves. But if you're in a wheelchair and you've ever taken that train, that is not an easy feat to get into that restroom, especially when it's moving, especially when there are bicycles in the way. It is not an easy feat. And what happens is if you're like myself and you're in a wheelchair and you're at one of the smart train stations, with the exception of a few, it is difficult to find a restroom that will accept. If I'm at give you an example, downtown Santa Rosa train station, right? Here's the deal. There are two places that are really open to the public restroom. One is Aroma Cafe. The other is Chevy's. Oh, thank you. The other is Chevy. And I'm bringing these. Is that on? Oh, yes. Yeah, it's on. I bring this to your attention. There is one other place, and that is the tourist center, but it's closed a lot. So here's the deal. If you're impaired, if you're mobility impaired, or you're a senior, or you're someone who's not really familiar with a particular train station or area, it may be difficult to find a restroom. And I know that seems like a real small thing for a lot of folks, but it's a big thing if you're in a wheelchair. It is a big thing. This proposal that I'm putting together is very simple. It's a clean cut goal. And what I'm looking at trying to do is to start a pilot. So we pick out particular stations along the line that we think would be beneficial to have a public restroom. And then let's figure out how we make that pilot happen. And then from there, maybe each station should have a restroom. I invite you guys to read through that. If you'd like, at the bottom of there's a link that'll give you access to my Google Drive where you can download this if you need it. And there's also information about the poll that I did on Nextdoor. That's kind of it. I'm hoping that you guys will take a look at this, and that's something that we'll be able to implement.
Great. Well,
Small
thank you,
steps first.
Jeffrey. I'd like to hear from folks in terms of what's in the planning for bathroom facilities at the station? Does anybody have some comments on that?
Unfortunately, we don't have smart representatives here, but we do have their contacts, so we can share your comments with them.
Please.
I am curious about whether there's any comments on facilities for transit that are ADA accessible in your transit facilities.
There are public restrooms at the Transit Mall in Santa Rosa. And I believe they meet the accessibility guidelines.
Barely,
Right?
barely.
It's a project keeping them open, but I think it's obviously the right thing to do. And I know we get requests for more than what we have available there.
There's a request for it, or?
Yeah, I think there's just really one stall in each bathroom. I think the men's has and 2 urinals as well.
So there's a possibility of getting more of them.
Well, we're limited by our square footage, but there are some possibilities for more, yes.
What about funding for something like that?
It'd have to be a special sought after funding source. I mean, you could use state funds but there's not necessarily a fund for that per se.
Thank you very much. I'm very familiar with that restroom. Here's the deal though, that restroom's up at the Transit Mall. I'm talking about Smart Train. And I get that, it's great to have that public restroom up there. Trust me, I've been in it a few times and it does need some additional stalls. But what I'm looking at particularly is smart train.
Right.
Okay, I'm looking at how do we make that happen for these locations so that people like myself don't have to try to make it up to the transit mall to go to the bathroom.
No, I was not suggesting that was an answer. I was just suggesting that there are facilities that have restrooms.
And I can make sure to connect you to Zoe Unra. She works with Smart Train and she's very involved in the planning.
Okay.
Yeah.
Great.
We can get some emails going.
Okay, is there any public comments online? No,
Actually, I do have one hand up.
there is.
There is one. Hi, Alice, as soon as you're able to talk, go ahead.
Alice, are you with us? Maybe your mic's off?
Me?
Here you go.
Yeah, you can hear me okay, can you?
Yes.
Okay, great. Is there a way to show my video or not?
No.
Okay.
No.
Well, two things, please. First of all, to the man who just made this proposal, and I'm sorry I missed your name, but that is a brilliant proposal. Thank you so much for making it, because I haven't been able to use the SMART train at all, and I'm passionate about transit use. And I'm on paratransit, and this is the number one reason I haven't been able to use the train all these years. In fact, I didn't know if there were restrooms on the train, but I suspect wouldn't be easy for me to get into. And I can only walk about 10 paces currently. And so it's really hard for me to get to paratransit. I don't have a scooter or mobility device other than a rollator. So, and I often have to use the restroom very suddenly and urgently. And this is a huge accessibility issue. So thank you very much for making this, and I would love to participate or contribute in any way I can to your proposal. And then my second question or comment is, thank you so much for having us and for having these meetings. This is my first time attending this, and I have some suggestions or concerns regarding paratransit that I would like to make. And I'm wondering if the roundtable discussion at the end of this meeting is the appropriate place to bring that up.
Actually, Alice, the appropriate time for that is during public comments,
Okay.
which we just had. That's when Jeffrey made his comments about the toilets on Smart. Is this something that you can bring back to the next meeting when we get to that part of the agenda?
Yes, I guess I'll have to.
We are currently public. Oh, okay. Well, it turns out we're still in the middle of making public comments. If you want to go ahead.
Thank you. I see I only have 26 seconds left. There are a couple of concerns, and I'll just mention them and maybe can go into detail at a later time, or if there's any time left at the end of this meeting. The first one is that paratransit is filling up very quickly. It's hard to get a ride nowadays. And I'll leave the other one for another time. Thank you.
Still go, right?
If she wants to finish her thought, I think that would be okay.
Yeah.
Alice, please go ahead with your second comment.
Oh, thank you. It's a pretty involved topic. So you know what, maybe I should come back at the next meeting and be more prepared to
Where was
uh,
she?
do a
And if-
proposal like the
If you want to
bathroom one.
send me an email with like all of your thoughts and comments, you can email that over and we can share it with the committee if you want to have all of the nuances explained beyond the 3-minute mark.
Wonderful, thank you very much.
Alice, also, could you tell us where you're located and which paratransit service you're a member of?
Oh, yes, I'm in Southwest Santa Rosa, and I primarily use the Santa Rosa Paratransit and occasionally county transit. And what I'm referring to is difficulty getting rides on the Santa Rosa service. Thank you.
And can I ask how far in advance are you calling to book rides?
Um, I currently I need to do 7 days in advance, and sometimes can't even get a ride when I call 7 days in advance. And 6 months ago,
So just real
sorry.
quick, Alice, sorry to interrupt you. For Santa Rosa Paratransit, you don't have to call, you can call up to the day before, or any paratransit throughout the country. You can call up to the day before to book a ride. So for Santa Rosa Paratransit, the earliest you can call is 7 days in advance.
Understood.
Okay.
What
And then they
sorry.
should, anytime you call, are they offering you a trip time that just doesn't work for you?
They're telling me that they don't have any rides whatsoever if I call. Now, yesterday I was able to get a ride for this Friday, but that's rare. Usually, if I call less than 7 days, I'm told that there are no rides available.
Yeah, I would definitely be interested in talking with you about that if maybe you can send your number or your contact because that is not common in our system. Would you say that's common, Mohammed? No, there's always going to offer you a ride. They're either going to offer you a ride an hour before or an hour after, up to an hour before or up to an hour after, unless you have an appointment, in which it won't be after, it'll have to be before. But if you're either somehow, all of our staff are trained to make sure they're offering you some ride. So that would be very out of the ordinary for you to not be offered some sort of ride.
Yeah, that used to be the case up until about 6 months ago, but more recently than 6 months, they say there's no ride all day long. And so
Yeah, so definitely send your contact information because I think there must be some confusion because I'd like to track that down if that is happening.
Okay, yes, and am I speaking to Yuri, please?
Yes.
Terrific, thank you.
We have another hand up from Kenya Martinez. Would you like me to unmute her? Ready? Okay. Oops. Sorry, Kenya. Give me 1 second. Oh,
Kenya?
sorry, I'm on the wrong.
Kenya, are you there? Are you with us? Is your mic on?
Hold on, that was my. Where did Kenya?
Okay, can you try it again?
Hi, I actually was gonna yield my time to Alice Lynn. That's what I put my hand up for. So I don't know if she still needs additional time. But if the issue is taken care of, I'm fine.
My issue has been taken care of. Thank you so much.
Yeah, I think she's good, Kenya, if you want to go ahead.
Yeah, I have no comment. I was just yielding the time to Alice.
Okay, thank you. All right, if we have no more public comments, we're going to move on to approval of the minutes from March we have an action on that. I also have something that I noticed in them that I'm going to bring up. Does anybody else have anything that they need to bring up on the minutes as well? Okay. I noticed that on part 5, the coordinated claim that Dana presented. At the end of that, there was a motion made by Kim Petty to recommend. And then there was a second by Jessica Alcazar. And I'm wondering, I don't believe Jessica was on the board at that time. Does that make a difference?
She wasn't in the committee meeting?
Yeah, she was at the committee meeting. We made an action on that and a vote. It was Kelly made the motion and Jessica seconded the motion. Do we generally have public people seconding a motion?
Jessica's a member of the committee.
She is now, but I don't believe she was at that time because that was the first time she was presenting.
Oh.
And she hadn't been on the committee. Does that make a difference at all? That we had a non-committee meeting member doing the seconding the motion.
I think Dawn and I can look into this after the meeting and see whether she was confirmed member or not. If she wasn't, then we can come back and bring the motion for a vote again.
Okay, so we would have to revote on that because I know that at that meeting, we discussed after that point whether we were going to bring her into the committee. So anyways, okay. That was the only thing on the, did anybody else have anything on the minutes from March? Nope. Does anyone want to bring a motion on passing the minutes for March?
I'll make a motion approving the minutes.
Okay, Yuri making the motion, and who's going to second that?
I'll second it.
Okay, Charles will second it. Okay.
All those in favor?
All right.
All those opposed? Motion carries.
Were there any opposed? No. Okay. Folks are going to have to speak up. Okay, now we're on to the Brown Act. And Ross, is he with us?
He is, he's online.
Let's see, can you guys hear me?
Yes, we
Yeah.
can.
Excellent. And actually, Dawn, do you have that presentation?
I do.
handy?
I will share it.
So let's see, this is just a very brief update on some new provisions that are available to all of our advisory committees and specifically the Transit-Paratransit Coordinating Committee, and I think that it will actually really be a big help. So this SB 707 is a recently passed update to the Brown Act. And let's see, next slide, please. And so the Brown Act, as you know, is mainly concerned with transparency, with making sure that the public has access to the meetings and what is taking place. The good news is SCTCA has been allowing hybrid participation as we just saw with public comment. We've been allowing that since before the pandemic. So this is not as big of a change for us. Next slide, please. So the main updates are, there's some related to multi-jurisdictional bodies, which is our board. That's not as much what we're talking about here. Mainly it is the ones related to the advisory committee. And next slide, please. So basically, the advisory committees will be able to use teleconferencing as long as it is approved by the body. And it sounds like we do have a quorum today, so you do have the opportunity to vote on that. Advisory committees in this case are defined as serving just in an advisory capacity and not taking final action on funding, things like that. And in the case of all SCTCA's advisory committees, legal has determined that we do fit that definition. Next slide, please. So again, these are all the ones that it applies to. And then we'll get to the meat of it in the next slide here. Sorry, we're going so fast. I know some of you have heard this before. Yeah, next slide, please. So basically, once approved, we will have the location open for the TPCC meetings as we do today. Staff will be there. And basically, committee members can either show up in person or log in remotely. And so the requirements there are that you have a device that allows both audio and video. We'll ask that if you have any other adults in the room, that you do disclose that at the beginning of the meeting, and that you do keep the video on the whole time. Votes will need to be conducted by roll call. However, remote members will count towards the quorum. So this is unlike previous teleconference setups. You do not need a quorum in the room. If remote access fails, if for some reason you lose your connection and you're logging in remotely, you will not be able to vote, and that could potentially bump down the quorum if the committee is closed. So that's really the main details to it. Advance notification is not required. This is different than the just cause provisions that apply to multi-jurisdictional and other committees. So we really hope that this will help with attendance and really getting people that may have a hard time getting to meetings given a better opportunity to do that. I will say that if folks are on other committees, SB 707 does have some more provisions for people with mobility issues. So I would check with your other committees as well, just to see if remote attendance is an option. Next slide, please. So today, we are asking the TPCC to vote to use these new SB 707 provisions. If it passes, then at the next meeting in July, that is an option. You can attend remotely. And authorization must be renewed every 6 months. However, that can be done remotely as well. Please let me know if you have any questions. I know I was moving pretty fast, but as more and more people pass these provisions, more folks are familiar. So happy to answer any questions. And yeah, then I'll leave it to the chair to conduct a vote.
Any questions on the Brown Act? I do have one question in terms of the quorum during a vote. If we lose technical connection, then the vote can't be taken at that moment. But say, could it be pushed back while that person is working on their technical issues to come back in and then follow up with the vote within the same meeting?
Yes. So if an individual who's attending remotely loses connection, and let's say you have just have hit the threshold for a quorum, then yes, the vote could be postponed until they are back. The big thing is, if for some reason SCTCA, like in the meeting space, loses the connection and the public is not available, then you have to stop the meeting entirely. But that's always been the case. So yeah, so you could move the vote around for that person to come back. Does that answer the question?
Yeah, it does. Great, thanks. Another question I had for you is, hopefully you can answer this. It's about reporting who's in the room with you. You have to report all adults that are in there. Can you explain why that is?
I guess I don't exactly know the reason, but I think it is just so that if you are in a space that, someone is not like influencing a vote or something like that, or feeding you lines or somehow influencing you. That is my guess, but it comes down to transparency. Basically, if people are, speaking in the room, they want to know who's listening in public as well. So I can research that, but that's been the case before this legislation for traditional teleconference or the old legislation AB 2449. That was also a requirement for just cause. So it's people over 18. So, the assumption being that, you might be taking care of children or something like that. That's not an issue. But if you have an adult, you do need to give a heads up. So
Okay.
yeah, that's purely speculation on my part. I'll need to find out.
Okay, I was just curious.
Yeah.
All right, would anybody like to make a motion to pass the adoption of the new Brown Act policy?
I believe we talked about this at the last TPCC meeting, and so appreciate you bringing it forward, and I'll make the motion.
Okay, Yuri is making the motion, and do we have a second on that?
Second.
And Kathleen Cortez is going to second that emotion. And do we do a roll call vote on this?
You do not at this time.
Okay, all those in favor say aye.
Aye.
Aye. All those opposed? Okay, unanimous. All right. Now we have the final comprehensive report plan with discussion with Chris. There he is online.
Yeah, hi everyone. So we talked about the comprehensive transportation plan a few months ago. I'm happy to be back to give a report out on the comments we received as part of the public comment period for the draft plan and talk about the final CDP. So let me go ahead and bring up some slides and walk through that with the committee. So first off, I just want to thank everyone for the comments you provided on the draft plan. We released that in January. The public comment period ran through March 23rd. So we received just about 50 comments on the draft plan. So in a variety of different, on a variety of different topics and areas, and I'll be summarizing those today. So we used those comments to compile the final plan. That's in final graphic design right now, and we'll be looking at releasing the final plan in the next few weeks. So when that is released, we'll go ahead and make sure we notify this committee that it's out there. We'll also be presenting that to our board of directors in June for approval. So just a quick reminder of the schedule. We kicked off this comprehensive transportation plan update back in 2024. We were engaged in all of these different tracks along the way, including public outreach and engagement. We took a look at the plan vision and goals. We updated our technical analysis, including a performance assessment. One of the big pieces of the comprehensive transportation plan is looking at transportation projects that are priorities for our local agencies, including local jurisdictions and transit providers. And then finally, producing a draft and a final CDP. So, as I said before, we released the draft in January, and we'll be releasing the final CDP in the next few weeks. So just a reminder on our CDP vision and goals, which guides the development of the plan and all of this work. So the CTP vision is really focused on connecting people with where they want to go, while at the same time moving towards a zero emissions transportation network. So, and we'd like to do that while prioritizing safety, equity, and quality of life. So we've actually identified 4 different goals to help us reach that vision. One is, again, focusing on connections and making sure our transportation system is reliable, that we can count on that to get around, that we're able to travel safely, and that our transportation system is well maintained and operating. Sonoma County is quite diverse. There are rural and more urbanized areas, and there are different transportation needs in these different areas. So it's important that our transportation system is really oriented towards our communities and individual places. And then finally, as stated in our vision, we're working towards a zero emissions transportation system. So I'll be walking through 2 different sets of comments that we received on the draft CTP. First, looking at our board of director comments, and then major public and advisory committee themes that we heard about during the public comment period. So we updated the plan, taking or accounting for these public comments and correcting errors, and we also added recommendations for future planning cycles. So if we weren't able to address questions or concerns in this plan, we are identifying those and we'll prioritize those going forward. So starting off with some of our board of director comments, they're very interested in e-device safety and coordination. There's a lot of concern with safety associated with e-bikes, scooters, and e-motos, and a lot of confusion about what type of device is what. um, so our board's very interested in coordinated education, looking at safety across jurisdictional boundaries, aligning their municipal codes and rules associated with these devices, and getting better data on crashes and collisions involving these types of devices also. So in response to these comments and this interest, we added some additional information in the plan on e-bikes and these other e-mobility devices. And we also added recommendations to coordinate that data collection and policy development. So there's consistency across the county on regulating these types of devices. So our board is also very interested in traffic calming and speed management. They want links to best practices, policies, and resources for speed reduction. So there are a lot of things out there that can help our jurisdictions move in this direction. One other thing that our jurisdictions would like to coordinate more on is consistent speed limits. And there's a desire that you're not shifting from different speeds as you cross a jurisdictional boundary. So a lot of interest in coordination there. So in response to these comments, we added additional information and links to resources on traffic calming, speed management, and speed limit reduction. There's a lot going on at the local, state, and regional level in this area. Documents that provide help and best practices on how to reduce speeds. There's new legislation that makes that easier as well. So we added that information to the plan. So it's a good resource for jurisdictions that are moving in that direction. And finally, there's quite a bit of interest on Highway 37, specifically on who's using it. So we were able to pull in information from a number of studies that looked at just that, looked at origins and destinations and traveler characteristics through the corridors. We added that information into the body of the plan as a resource. So moving on to more general comment themes that we heard from the public and our advisory committees. The first, we heard broad support for the CTP vision and goals, but there are questions about the feasibility of those goals and vision, if we're doing enough to reduce GHG emissions, but on the other side, concerns that focusing too much on GHG reduction will distract from improving and preserving our roadways. So I would note that these are somewhat conflicting comments that we received, but we recognize there are a variety of opinions and viewpoints across the county, and the CTP does focus quite heavily on GHG reduction, but also on pavement maintenance and pavement quality projects as well. So we included additional references in the plan in response to these comments, pointing out supportive planning efforts, actions and programs that are underway. We added recommendations to dig into this further going forward in the plan. And as I mentioned before, we pointed out the different types of projects that are both supporting GHG reduction and pavement quality improvement in the plan. So we also heard recommendations to make the plan more clear and concise and oriented toward action. So the plan is pretty dense. It's over 100 pages with a lot of reference information in there. It's kind of a balancing act since SCTCA staff and other local staff use this reference information quite frequently in their planning and engineering across the county. So there's a lot of value in that. But at the same time, a 100-page planning document is somewhat difficult to consume. So we'll be considering making it a shorter document and pushing some of that reference material into the appendices in the future. So there's also desire to look at quantitative metrics and scoring. We do some of that in the plan as part of the performance assessment. We're doing some of that as well as part of our funding program scoring, which will incorporate when we evaluate near-term implementation for the plan. But we added additional implementation recommendations in the plan by each of those goal categories to help provide more direction and make the plan more action-oriented. And as I said before, we'll evaluate the format of the plan going forward in future planning cycles. Similar to our board comments, there's a lot of interest and support for improving safety, traffic calming, and looking at speed limits, and coordinating on electric mobility devices. So again, as we did for our board of directors, we added a lot more content and policy recommendations to the plan associated with these devices and provided additional references to active transportation plans, our Vision Zero action plan, and other documents that are focused on safety and implementing these types of approaches. A lot of interest also in transit, specifically looking at transit reliability, frequency, transit integration, expanding SMART, and really focusing on our active transportation network. So as most of you already know, there's a lot going on in this area in the county already through mascots and other transit integration work. So we made sure to talk about that in the plan and provide links to outside resources covering transit integration, and also included additional content on first last mile improvements and strategies and ties to active transportation. We also heard concerns about congestion in major travel corridors, including Highway 37 and Highway 12. So as I mentioned before, we had included additional information on Highway 37 specifically, and would point out that the CTP does include many projects that are focused on reducing travel demand and congestion, both in these large regional traffic corridors, but in local neighborhoods as well. And then finally, a lot of interest in clear GHG reduction strategies, including electric vehicle planning and infrastructure rollout, thinking about the power grid, shifting freight to rail and non-gas oriented travel modes, and thinking about emerging technologies like automation and drone delivery and stuff and things like that. So we added additional content associated with these topics, a lot on electrification, as I mentioned before, transit integration and active transportation. And then we have a whole appendix focused specifically on recommendations for greenhouse gas reducing actions associated with transportation. So one thing we'll be doing later this year is looking at what we can do in the near term. The Comprehensive Transportation Plan is a 25-year planning document, so it's looking out pretty far into the future. And we want to take a closer look at what we can do in the next 5 to 10 years to move towards that vision and achieve some of those goals. So one thing we're doing is we're scoring priority projects that have been submitted by local jurisdictions and transit providers. So we can line those projects up with funding sources that SCTCA administers in the next 5 to 10 years. So we're working on scoring those projects right now. Results of that will be available this summer, and we'll use that to put together a near-term implementation plan, including those priority projects and funding recommendations in the next 5 to 10 years, and also looking at some short-term policy recommendations that we can make in a similar time frame. So we'll be working on that this fall and winter, and that'll be a companion document or a follow-up document to the comprehensive transportation plan. So with that, I'll just mention again, really appreciate any comments we received from you as a committee or individuals on the plan. Very helpful in helping focus that final draft. And also want to mention that we'll be releasing the final document that's looks great and has gone through that design pass in the next few weeks. So looking forward to getting that out to you all very shortly. So with that, I'll go ahead and wrap up and turn things back over to you, Madam Chair.
Okay, any questions or comments?
Sure, I'll offer one. This is Yuri with Santa Rosa City Bus. I know that internally the city has done some work around reducing speed limits and traffic congestion and pedestrian safety, and particularly road dieting and those type of things. And from a transit like operations perspective, I think we're seeing some impacts on our on-time performance, which I think is another goal, and affects ridership and operations. So I would just caution in the plan that, and although I'm completely for those other goals, ensuring that the designs also allow for queue jumps or transit prioritization, or focus the lane dieting on or just identify where there are transit corridors and ensure that those measures don't impact the route, or that a lot of times it just really takes an additional design to get all those goals met, rather than I think sometimes we don't really know how to. It's a little more difficult to keep the buses on time and not just reduce the travel lane. So taking those extra steps is something that we're seeing is impacting our routes at this time.
Yeah, really appreciate that, Yuri. And, there's a movement towards more coordination on those street improvements as well. So hopefully we'll see that move forward in the coming weeks and years.
Thank you.
Okay, and we've got Alice online, hand up. Alice?
Yes, thank you very much. And thank you for this presentation, Mr. Barney. I have a question about, I receive periodic notices from Santa Rosa City Bus telling the public that certain routes have needed to have some service cuts. And I'm wondering what the future is looking like for city bus and perhaps county transit, because I'm passionate about having as much bus service as possible. And also, as a paratransit user, my understanding is that the cost of paratransit comes out of the fixed route budget. So I try to use paratransit as little as I can. And because I really want to support fixed route. And so I'm wondering what the long-term picture might be, and if that's discussed in this plan, or perhaps Yuri can tell me. Thank you.
Yeah, maybe I can take a first pass, and Yuri may have some comments as well. But from a long-range planning perspective and the CDP, each of our transit agencies in the county have included a number of pretty visionary projects in the plan, looking at improving headways, expanding routes, making the transit system easier to use, but it's all very dependent on funding and resources. So there are a lot of great ideas out there and big plans. SCTCA is committed to helping fund these as we can. So one thing, having a project or an idea in the comprehensive transportation plan helps line these projects and ideas up for grant funding and other funding sources. So that's a first step in moving in that direction, but it's very resource dependent, and we're hoping we can get there, but it's hard if you don't have the funding to do some of that. So um, from a long range planning perspective, things are lined up that way if we can get the money to do it.
Any other questions or comments? Chris, I have a question for you. This is a 5-year plan that is this, you had mentioned something about planning cycle on this. Is this ongoing, or is there's a specific amount of time that you guys focused on this particular plan?
Yeah, that's a really great question. We update the comprehensive transportation plan every 5 years, but we look out 25 to 30 years into the future. So it's a long range planning document that looks out long term. So we consider where we think people are going to be moving to, and how much growth there'll be in the future, and how that'll impact travel conditions, and what needs may be in the future. But as I mentioned, one new thing we're doing this time around is looking in the near term as well. So looking out to the next 5 or 10 years and what we can do in that shorter time frame to help move towards that vision that we've set as part of the plan.
So I'm wondering, is this a time frame that's focused specifically on right now, or this is an ongoing process that you take feedback on continually, or maybe a mix of both?
Got it. Yeah. So we update the plan every 5 years or so. So that's kind of the cycle that we take comments on. We're happy to take comments anytime on the plan or our activities, but to get things into a specific plan, it's kind of during that 5-year cycle.
5-year. Okay, got it. All right. There's no more questions. Oh, we've got Jeffrey.
Hi, thank you, and thank you for your presentation. I'm interested to find out about your plan and how you see the elderly population in Sonoma County increasing over the next 5 years, 10 years. How are you guys going to be addressing services for folks that are going to be becoming seniors?
Yeah, thank you for that question and that comment. So we definitely see the population aging, and along with that will come a lot of different needs associated with that. Including potentially needing to import labor from out of the county, different transportation needs. So we are anticipating that. We've called that out in the plan, and we are coordinating with the county on their planning associated with the aging population in the transportation sector as well. So that's a good venue to kind of dig into that. We touch on it at a pretty high level in our comprehensive transportation plan, and we'll continue to coordinate on those specific planning efforts associated with the aging population to plan for those specific needs. But thank you so much for that question. We're tracking that and know it's going to be a growing issue.
And there's no hands up online? Hard to see. Okay.
Yeah, hand
Madam Chair,
online.
I see one more hand.
Is there a hand up there?
Yes, there's a hand up there.
Okay.
Selena, when you're able to talk, go ahead.
Thank you. This is Selena Gonzalez at the Council on Aging. Great overall presentation. Just adding on to that previous question about incorporating the elderly and that population growth. I'm curious, is there any specific consideration towards the increase in those who need dementia care, something that requires door-through-door handoff for transportation?
Selena, thank you for that comment and question. We don't have a specific discussion of that in the plan or as a project, but we can look into getting more information on that in the future. So we'd
Great.
love to reach out and coordinate on that.
I'd love that. Thank you.
Okay.
And there is also the Sonoma County Master Plan for Aging, which delves into these topics much more deeply.
I don't see any other hands raised.
Okay. All right. So let's move on to item 6, which is Jessica Alcazar from to discuss the Master Plan for Aging Intro to Volunteer Driver Program.
Good afternoon, everyone. So from our previous discussion, we talked about furthering collaboration between all the different transportation agencies in the community, including our volunteer driver programs. So we wanted to invite our volunteer driver programs to do presentations just so that everyone understands what resources there are in the community apart from our transit agencies. So we have 3 presentations today. One will be from My Ride through Vintage House, which is located in Sonoma. The other one is also Fish, which is Friends in Sonoma Helping, as well as our 211 United Way transportation program. So if Sandra Porter is okay with going first, they will go ahead and present on their own programs. Some of them have presentations, which I believe is Denise, but she's not online, I believe, yet. So if you can go ahead, Sandra.
Denise has her hand up. Oh.
Do any of these people need to be promoted to panelists?
Yes,
Can you tell
Denise
me
could
their
be
name?
promoted to a panelist. Can you remind me the name, Sandra?
It's, yes, Denise, Sandra, and then Soumya.
And I see 2 Sandras there. Sandra Porter.
This
Yes.
person here?
Yeah. Yes, that one. It's a little hard for me to see.
I've got a Alex and Araceli. You can.
What was the third name?
It's Denise, Soumya, and Sandra.
I don't have a Sonia on here.
She's the bottom one, I believe.
Okay. This one.
Mhm.
Thank you so much, Dawn.
Sure.
Okay, well, thank you for the invitation. FISH is an organization that's been in Sonoma Valley for the past 55 years. And we do have a service area, which is Sonoma Valley, Kenwood through Shelville. And we are an all-volunteer organization. And what I put together is just the statistics for the last 2 months to give you an idea of the breadth and depth of the services we provide. So in the last 2 months, we have provided gasoline for medical appointments to 31 different people, and that is a cost of about $930. We have offered private car rides to 105 people to dialysis. And as you may know, the dialysis is Napa, is probably our number 1, Petaluma and Santa Rosa. We have provided 104 other out-of-town rides, Lakeville, Marin County, San Francisco. Our local hospital is connected with UCSF, so we have a number of rides there. And we have provided 43 local rides. So that's about a 2-month window of March and April. And so altogether in those 2 months, we've provided 252 private car rides. unlike my ride, we consider a ride a ride. So if you're going to San Francisco, we stay there, park, and bring you home and count that as one ride. We don't count every stop as another leg of a trip. We had, in those 2 months, we had 3 unfilled rides that we just couldn't find someone to go to that particular place at that particular time. And we had 32 rides canceled. And we do have a few little glitches. Friday afternoon rides to Petaluma are pretty horrendous. So we really encourage people not to make Friday afternoon appointments. We have about 50 drivers, and the match is made between who's available. And also, some people are more comfortable with some people. Some people want a woman driver, and some would prefer a male driver. We don't have a lot of restrictions on who we give a ride to. We don't have an age restriction, for example. And we do work with walkers and oxygen. And we are comfortable going up to people's door if they don't hear us, knocking on the door and saying we're here and making sure they're in the car safely. As you know, with dialysis, you have to get people to the door of the dialysis provider, and you have to be there at the door of the dialysis provider to escort the person to the car. So we do have a training program. It's been successful. And in that program, we talk about particular needs of seniors. Some people who are in pain need quiet. Others haven't seen a live body for a long time and like to chat, and encourage the driver to use some tact in saying, this area we're in is unfamiliar to me. As soon as I know where I am, I'll be happy to chat with you. So it's been successful. We're targeting about 1,500 rides this year. And that's kind of the good news from the fish transportation system.
And how do we contact you if
Oh.
someone is watching this online later on?
Sure. The best way is to call 707-996-0111. Then the person who answers the phone takes your information about when is your appointment. I should add that we ask for a week ahead of time to establish the ride. So where's the appointment, what time it is, the doctor, those kinds of things, and then they receive a call back, at least 1 or 2 for confirmation. And so far that's been working. There's no fee for service. So I think in a nutshell, that's kind of the program that we offer. And we too anticipate, as people get older, more requests. And we also have had some requests for Today and Together, a new program up in Hannah, about 6 miles out of downtown Sonoma, to consider that respite care or daycare as a medical ride. At this time, we're not able to do that. We just don't have the drivers, but we do see it as an ongoing issue and hope to work with, continue to work with My Ride and other providers in the valley to address the issue of, one, the increase in dementia, the increase in dementia services, and the increase in aging.
Have you been tracking the increase in requests and use? You said 1,500 rides this year. How does that compare to last year?
I think it's up a little bit. If we look at a longer term, like back to COVID, we continued to give rides during COVID, but doctor appointments were fewer and further between. So we are building up. We also, dialysis has a huge impact on us. And we have, let's see, we also have dialysis, people who we give paratransit tickets to access dialysis. And in April, we had 17 of those, and I think about the same so 34 rounds of tickets, which is maybe a 2-ticket or 4 tickets for there and back. But we provide those free to the people in need. But the dialysis has a huge impact on us because they require 2 drivers. It's a 4-hour process. And we try and do clever things like work with the dialysis center to bring 1 or 2 people there and hopefully then be able to pick up someone who has just finished dialysis and bring them back to Sonoma Valley.
And then besides the increase of numbers of use, you're also tracking how many people you're having to turn away because you don't have the resources, correct?
It's not, well, yes, it's very small. Like in 2 months, it was 3 people, and I would say that's probably many months we have 0. Perhaps for us, a bigger impact is the cancellations. The cancellations far outnumber the 1 or 2 rides that we may not be able to fill. And that's because of the age of the population and the health of the population we're working with.
Okay, great. Thank you. Were there any other questions? Yes, Jeffrey.
Hi, thank you for your presentation. It's very nice. And I'm familiar with your organization. My question is, do you at this time have the capability of assisting somebody who is in a power chair? Do you have drivers that have a Hoyle lift? You have drivers that have van access where you can actually put the chair inside. The biggest problem that I see in this county is that, yes, we have great transportation for people that are in a chair. It becomes a little more difficult when you're in a power chair, obviously, because it's a bigger chair, you can't fold it up, you can't do those sort of things. Do you know if you guys are able to assist people who are, in need of getting to an appointment and have a power chair?
We do not have the capacity to help someone in a power wheelchair, and even a wheelchair may be difficult depending upon the size of the wheelchair, a traveling wheelchair over against a more significant weight, because we have all volunteer drivers, and most everyone hasn't seen 65 for quite some years, so it's an older group of volunteers. But yes, I understand the concern, and there are a couple of vans in town, but I like the health center has a van, but I'm not sure any of them can deal with a power wheelchair. I think maybe the health center can do that.
All right, thank you very much.
Thank you for your comment.
And we're like 20 minutes left for the meeting, so yeah.
Okay, and who is the other one?
Denise. Denise, if you want to go ahead and unmute.
Good afternoon. Can you hear me?
Yeah, welcome.
Hi, I'm Denise Collier, and I'm the transportation coordinator at Vintage House Senior Center here in Sonoma Valley. We partner quite nicely with Fish, and between our 2 organizations, we seem to be able to provide transportation to most of the seniors in Sonoma Valley. We've been offering rides to Sonoma seniors since 2009, and our mission is to keep seniors active and engaged in the community so they're not isolating at home. Most of the rides that we provide are for things like shopping and errands, hair appointments, and things like that. We bring a lot of people here to Vintage House to participate in classes and programs, and we do some local medical rides. Our service area is Sonoma Valley only. We'll go as far as Kenwood, but we don't go out of town. I have about 40 volunteer drivers. They drive their own cars. They're all wonderful human beings. We appreciate their volunteering very much. Last year, we provided about 4,500 rides, and we served over 111 Sonoma Valley seniors. So it's been very rewarding. and it's a great service that we're able to offer.
Great, thank you. Any questions?
How do people get in contact with you?
They can just give me a call.
And what is the number?
Yeah. 509-3186.
Thank you.
We have a hand up as well.
Do you want me to unmute Selena?
That
Yeah.
Alice.
No, it's Selena.
No.
I
Hand. Oh, I see the hand up.
It-
Go ahead, Selena.
It's Selena from Council on Aging again. I just wanted to
Hey.
give a big shout out to Denise at the Vintage House. She's been able to coordinate rides with that door-through-door handoff for our dementia respite program that we host at the Vintage House. Without that transportation to give the participants an opportunity to continue social engagement, physical exercise, and an opportunity for caregiver respite, there would be a lot of families that would be put out and unable to participate. So thank you, Denise, for everything that you do for us and for the community.
You're welcome.
Yeah.
Thank you, Selena. Who's the other person?
Thank you, Denise. Our next presenter would be Somya, and she's from our 211 United Way Transportation Program.
Hi everyone, this is Soumya from United Way Wine Country 211. Thank you, Jessica. And I'm here to tell about our program, which is Ride United Transportation Access. And we got this grant we are doing this grant with collaboration with United Way Worldwide. They have provided us a grant which is Ride United Transportation Access, and this morning, we have completed our goal of providing 250 rides, but I'm here to give you as information about our transportation program because we are writing a grant next month and we may get another grant for next fiscal year. So this grant is all about helping Sonoma County residents a free lift ride. They can use it for health purpose like medical appointments, dental appointments, or for the going to their work or going to school, or going for job interviews and for example, going to food pantry locations, and also there is no question we ask except the age and the first name and last name, pickup address and the drop off address. There is no age limit to, but who are younger, below 18, a guardian should be present to take a ride, like like who goes to school, and if the parent present with them, we can also provide a ride. So the use cases are more, and but for this season we have just completed our goal of providing 250 rides, and the data looks like majority used by 50 plus for health medical rides, and some of the rides in 250 used for going to their commuting to their work. And so we are trying to write this grant for next fiscal year, and we are trying to get more money beyond 250, like 500 for next fiscal year. And if we get this grant, the program will start in August 1st, 2026. So they can contact us by calling 211 Sonoma. 211 Sonoma people will ask some questions like demographics there, like the zip code and everything, and they will forward to us, and we will schedule a call for you, for the people in Sonoma County. But the one thing I want to highlight here is there is certain ride amount limit we put as a cap, like $27. But we always try to monitor our budget For example, for one caller, if the ride cost is $13, we will compensate from this 13, like the remaining $14 to provide the ride which is costing $40. So we always try to monitor the ride amount budget we have, and we try to fulfill the rides people are requesting. Thank you.
What is the 211 service area?
Its service area is Sonoma County.
So all of Sonoma County.
All of Sonoma County.
Yeah.
Yes, yeah, but sometimes people call us from Sonoma to Santa Rosa. That would take us $75. But we always try to monitor the amount, and sometimes we may deny the service.
Are there areas where Lyft does not operate in Sonoma County that you're aware of?
Yes. So in Cloverdale, we do not have many Lyft drivers. So what happens is, Lyft driver has to go from Santa Rosa to Cloverdale to get back to them to Santa Rosa. So this would cost a little more dollars than $75. So sometimes what happens is, because of Lyft drivers unavailability in Cloverdale, the ride will get cancelled. Although we provide the ride get cancelled. So there are some there are some learnings we have learned this fiscal year, because we did this grant for the first time at United Way Wine Country, and we are trying to incorporate these learnings to how to do for the next year.
And we contact you through 211?
Yes, calling 211, but for this fiscal year the rides are completed.
Great. Thank you.
Yeah.
Can I see a hand online? I think it says Linda Chaffin. Oh, and she's from the Master Plan of Aging Action Team.
Linda, when you're able to talk, go ahead.
Hopefully it's now. So I looked into requesting a ride for medical transportation through the United Way 211, and I live in Cloverdale. I was told that there was a mileage limit and you weren't able to provide the service.
Yes, that's the reason we put the limit, as we tell our call specialist who take calls for 211 Sonoma. We have put a limit of $27, because as per the grant we received. So if the ride cost us more than $27, and if we do not have the budget, like every time we monitor the budget, but if we cross the budget, we tell the people that we cannot provide this ride at that time.
Okay, so is the limit the amount of money the ride's going to cost, or the mileage? Because I'd be willing to only have partial help.
So it depends with the Lyft, how Lyft platform works is, depending on the mileage, it gives us the amount.
Right, but do you see what I'm trying to say is that even if you weren't going to cover the full amount dollar-wise, I would still pay the other share for the ride. But what you're
Yes.
saying is I can't even get the ride because of the mileage.
So the program we did is, we do not have that type of service. Like there is no the program we did for this year is, we couldn't provide that type of service, like $27 from our pocket and remaining dollars from your pocket. There is no a chance to provide like that. But for the next fiscal year, we are trying to bring that into our service.
Okay,
By
that'd be
using
great.
by using
Thanks for clarifying.
Yeah, thank you so much. We are trying to bring that into our service, like $27 from our pocket and remaining dollars from the client pocket.
Thank you. And we're down to 10 minutes left for the meeting.
We have another hand raised. Would you like me to?
Perhaps we can move on to the next. Is this an urgent question?
I would have to allow them to talk.
Yes. Yes.
Alex, when you're able to talk, go ahead.
Hello, good afternoon. This is Alex. I'm the transportation coordinator from Sebastopol Senior Center here, and we cover, it's kind of the same question. Right now, we're covering Russian River. So it seems like I was trying to use your service 211 because I have some clients that live on Gurneville, far away in the rural area, and they just trying to go to Santa Rosa. Because sometimes I have a volunteer heading back to their place, but I don't have a volunteer, heading to the hospital. And it seems like now you answered that question they had before. It seems like Lyft drivers tends to cancel them because I think the mileage limit. But this is actually good news that you guys gonna bring in this in consideration for the next year.
Yes, because we get so many calls from Garnival, Occidental, Sonoma, and
Yeah.
Cloverdale. Because of the budget we have, we could not able to provide them the service. So that's the reason we have coordinated with our grant team, and they have given us some another options to bring the discounted service, that is cap limit dollars from our pocket and the remaining amount from the client's pocket.
Okay, you guys make this happen. It's gonna help a lot of more participants who live in a rural area. Thank you.
Yes. Thank you so
Okay,
much.
we're going to have to move on. So if there's more questions, go ahead and contact 211 and they can fill you in on more details of how their program works. Thank you. Roundtable discussions. Is there anybody who would like to start?
Just to segue before we go into roundtable, thank you so much for coordinating these presentations. I know that was a lot of work. And as part of the master plan for aging, it's really nice to see everyone logging in for it. It's nice to hear about all of these volunteer services out there. So now we've heard from True Private Services, Onward Rides, and GoGo Grandparent, and Volunteer Fish, Vintage House, and 211 United. We're going to have more volunteer programs come in and speak with us. Thank you so much, Jessica, for coordinating. We're hoping this will help everyone know more about the gaps and how we can connect them. And maybe people watching these recordings can learn about what's out there. Okay, go ahead.
Roundtable updates.
Great. I appreciate that. And I'll just also say, Jessica, thanks for coordinating that. And if there's like something that on the operator end, I know I think two of those three presentations, 211 might be the only one that overlaps our service area. So, if there's certain organizations that overlap with paratransit service areas, particularly that we can get better coordination, please just reach out. And it definitely helps our clients who call in to know who has space for them, when they're calling and having options. It's really useful. I know to Mohammed's team when they're on the line to be able to refer people to other places that can provide rides. So in terms of an update from City Bus, I think we have some new electric buses in. I think we are also doing some, we've begun some service planning with our new, with trying to look at our routes and see where we need additional service. So if you're interested in being part of the public comment, please make sure you sign up for our Gov Delivery emails, and there'll be some public comment sessions in within the next couple months. There's nothing else that's coming top of my head in terms of updates. Everything else is going pretty well. I'll pass it on to John.
I'll make it quick. We have no real updates at this time.
Our biggest update is that we got a new paratransit director on board finally. So that's exciting. Haven't got much time to kind of communicate with her. Only had maybe one Teams meeting. So looking forward to getting to know her better and learning about her previous experience. Outside of that, our new webpage for our strategic plan is up. So everybody can go to sctransit.com and it's featured on the front page of our website. And then you click the link and that takes you to the strategic plan timeline and everything that we're looking to do. So that's pretty much it.
Area Agency on Aging, we are getting ready for our next 4-year needs assessment. And what that is we will be doing a survey for older adults and people with disabilities about their priority needs in Sonoma County. So soon we'll be rolling out a survey and planning focus groups in all of the 5 districts. So stay tuned. We want everyone to participate in the survey, and hopefully our paratransit user groups and other nonprofits will be able to help us distribute that survey to your clients. So that's what we're working on.
And I don't have any other updates apart from we'll have 3 more agencies doing presentations at the next meeting.
On the city paratransit side, we don't have any changes from the last time, and our ridership stayed the same. So there is no growth yet.
Just a quick update, we had the annual Aging Disability Resource Expo, Paratransit came out, and overall good expo, and looking for next year's.
Other business?
Well, thank you so much, Master Plan for Aging, members that are online and here for doing the good work and finding gaps and connecting and having a discussion about the volunteer programs. And thank you so much again, Jessica, for all that you've done.
Adjourned.
Thank you.
Yeah, we need to.